Hello guys, welcome to Doctors of Medicine. So today we're going to talk about the abdominal aorta. We're going to talk about its cause, its origin, as well as its branches. So what's the origin of the abdominal aorta? So let me just take you back to thorax. We are going to have a heart. The heart is going to give us an ascending aorta. From the ascending aorta, we have the arc of the aorta. And then it's going to continue as the descending aorta, which is also called the thoracic aorta. Then it's anterior to the vertebrate teeth curve. You're going to find that the aorta is going to pass posterior to the medial arcuate ligament. And then it enters the abdomen. When it enters the abdomen, it's going to give various branches. Some of them, they are visceral branches. Some of them, they are paired branches. Some of them, they are anterior branches. So I'm going to start with the main three important branches that are given by the abdominal aorta, which supply the gut, the GIT, the foregut, the midgut, and the hindgut. So at teeth curve, just inferior to the aortic hiatus, we are going to have what we call a celiac trunk. Celiac trunk. So the celiac trunk is going to give us three branches. It's going to give us splenic artery, common hepatic artery, as well as the left gastric artery. Let's go with the left gastric artery. The left gastric artery is going to supply, is going to move towards the cardia of the stomach, and then it's going to give what we call an esophageal branch. That is going to supply the abdominal part of the esophagus. The left gastric artery is going to descend around the right border of the stomach, which is the lesser curvature, and anastomose with the right gastric artery. So you need to take note of this, that the left gastric artery is the smallest branch of the celiac trunk. We go to the splenic artery. The splenic artery is the largest branch of the celiac trunk. It's going to go posterior to the stomach, but superior to the pancreas, giving 10 to 12 branches to the pancreas. And then it's going to go towards the hilum of the spleen via what you call the splenic ligament. And then at the hilum of the spleen, it's going to give 6 short branches, gastric short branches, that are going to supply the fundus of the stomach. And then it's also going to terminate by giving us the left gastro-omental or left gastro-epiploic artery. Right. And then in the hilum of the spleen, it's going to give us 6 branches that are going to enter the hilum of the spleen. And you need to take note of this. These are 8 functional branches. They do not anastomose inside the spleen. Common hepatic artery. The common hepatic artery is going to give, remember these branches that we are talking about, these are retroperitoneal. So they are going to, the common hepatic artery is going to give us what you call the right gastric artery. Remember, at the lesser curvature of the stomach, at the lesser curvature of the stomach, we are going to have the right gastric artery anastomosing with the left gastric artery. So the right gastric artery is a branch of the common hepatic artery. So it's going to give another branch, that's what we call the gastroduodenal artery. The gastroduodenal artery, it will go posterior to the first part of the duodenum, and then it's going to give 2 branches. Before it goes posterior, it's going to give what's called a supraduodenal artery. And then posteriorly, it's going to give another branch. This gastroduodenal artery is going to give what we call the right gastro-epiploic artery or the right gastro-omental artery that anastomose with the left gastro-epiploic artery around the greater curvature of the stomach. So these are the main branches that are coming from the celiac trunk. So the common hepatic artery, when it gives the branches, those branches, the right gastric artery and the gastroduodenal artery is going to continue as the hepatic artery proper. The hepatic artery proper is going to enter the hepatic duodenal ligament, that is the anterior border of the epiploic foramen of Winslow. So it's going to, in the duodenal hepatic ligament, it's going to bifurcate, giving us the right hepatic artery, the left hepatic artery. Take note of this. The right hepatic artery is larger than the left hepatic artery. Why? Because the right hepatic artery, it will give a cystic artery that will supply the gallbladder. So these are the branches of the celiac trunk, right? So at the transpyloric plane, that is the plane that is about the lumbar vertebral L1, we're going to have the origin of the superior mesenteric artery. So the superior mesenteric artery is going to run in the root of the mesentery of the small intestines. Right, let's see its course. So it's going to run posterior to the neck of the pancreas, right? And then it becomes anterior to the antennate process of the pancreas, and then becomes anterior to the third part of the duodenum, and then it's going to be posterior to the transverse colon, and then it's going to run towards the right, giving special branches. Right. So the first branch that you need to take note of is the inferior pancreatical duodenal artery. The inferior pancreatical duodenal artery supplies a part, the medial aspect of the duodenum, and the head, mainly the head of the pancreas. So it's going to give us the anterior and the posterior. So the anterior branches are going to anastomose with the anterior branches of the superior pancreatical duodenal artery, and then the posterior as well, right? And then as it enters the region that is within the large intestine, there is going to be a branch that we call a medial-colic artery. The medial-colic artery is going to give us a right and a left branches. So the right, they're going to supply the transverse colon, right, even as well as the left. But the left, they will end at the distal 1/3 of the transverse colon. Remember, at the beginning of what? Of the hindgut, right? And then it's going to give another branch, what we call the right colic artery. The right colic artery is going to give an ascending branch and a descending branch that will supply the what? The ascending colon. And then it's going to give what's called the duodenal and ileal artery, or the ilioduodenal artery, that are going to supply the jejunum, right? And then we're going to have terminally, it's going to terminate by giving what's called an ileocolic artery. The ileocolic artery is going to give the cecal artery. The cecal artery, we're going to have posterior and anterior. The posterior is going to give what you call an appendicular artery that supplies the appendix. So basically, that is the course and branches of the superior mesenteric artery. So let us talk about the inferior mesenteric artery. So the inferior mesenteric artery, it supplies derivatives of the hindgut, meaning the distal 1/3 of the transverse colon, the descending colon, the sigmoid colon, the sigmoid, the rectum, and then the upper 2/3 of the anus. Right. So let's go with the course of the inferior mesenteric artery. The inferior mesenteric artery originates anterior to the lumbar vertebrae 3, and then it's going to descend. As it descends, it's going to move medially to the left ureter. So it will be medial to the left ureter, and then it's going to give a branch. The first branch that it's going to give is what we call the left colic artery. The left colic artery is going to supply a part of the distal 1/3 of the transverse colon and the descending colon. And then it's going to give another branch, what we call sigmoid, branches for sigmoid arteries that are going to supply the sigmoid, right? And then as it descends, it's going to pass, when it passes through the anteriorly to the left common iliac artery is going to change its name. So it will be now referred to as the superior rectal artery. So the superior rectal artery is the ones that are going to supply the upper 2/3 of the anal canal. So you need to take note of this. There are branches that anastomose between the inferior mesenteric artery and the superior mesenteric artery. We have what we call marginal branches. Marginal branches. So these marginal branches, they run along the borders, the medial borders of the transverse colon. So they are going to anastomose with the branches of the iliocolic artery, the branches of the mid-colic artery, branches of the right colic artery, anastomosing around the borders of the large intestine or the large bowel. So this is the cause of the inferior mesenteric artery. Right, so we spoke of the celiac trunk, right? The superior mesenteric artery, right? As well as the inferior mesenteric artery. So these are anterior branches of the abdominal aorta and they are not paired, right? So now I want to talk about the paired branches, right? So we are going to start with the inferior phrenic arteries, right? That originates superior to the celiac trunk, right? So we have the left and right, since we said that they are paired. So the left and the right inferior phrenic artery, they are going to supply, one, the inferior aspect of the diaphragm. Two, they're going to give branches to the esophagus. Remember, the abdominal esophagus is supplied by the branches from the left gastric artery and as well the branches from the inferior phrenic artery. And then also the inferior phrenic artery is going to give what's called the superior suprarenal artery that will supply the suprarenal gland. Another branch we have, we said the celiac trunk, right? We are going to, between L1 and L2, we're going to have another branches there. We're going to have what's called the medial suprarenal artery. So let me just give you a brief arterial supply to the suprarenal gland. So the suprarenal gland is supplied by 3 arteries, being one, the first one being the superior suprarenal artery, which is a branch of the inferior phrenic artery. 2, the medial suprarenal artery, which is a direct branch from the abdominal aorta. And then we have 3, what you call the inferior suprarenal artery, which is a branch of the renal artery. Right. So between L1 and L2, we are going to have just superior to the origin of the renal artery, we're going to have the mid suprarenal artery. You good? Then just above L2, we are going to have another branch, what we call renal artery. So there are 2 of them, right? One from the left, one to the left, one to the right. So you need to take note of this. Since the abdominal aorta is in the midline towards the left side, so you're going to find that the right renal artery will be longer than the left renal artery. So the right renal artery is going to supply the kidney. When it enters the hilum of the kidney, it's going to split or trifurcate into 3 branches, into 3 terminal branches, 1 anterior and 2 posterior. These are also end functional branches. They do not anastomose. Right. So that is the renal artery. Right. So as we go down, we are now at a level L2. At L2, we are going to have what we call a gonadal artery. Right? Meaning in females, it's going to be called an ovarian artery, and then in males, it's going to be called a testicular artery. So the testicular artery, this originates from L4, and then it's going to move anterior to the ureter, anterior to the external iliac artery, and then it enters the inguinal canal and go and supply the epididymis as well as the testis in male. Right. So that is L2. L3, we already spoke of what? We spoke of the inferior mesenteric artery. So at level of L4, the abdominal aorta is going to trifurcate, giving us the right common iliac artery and the left common iliac artery. And then posteriorly, we're going to have the middle sacral artery. So at each, at L1, L2, L3, and L4, we are going to have posterior branches, what we call lumbar arteries. So these lumbar arteries from other zones, they are going to supply mainly the lateral portion of the abdominal cavity, supplying the skin, and as well as the lateral abdominal muscles. Right. So basically, this is the course and branches of the abdominal aorta. Thank you.